So welcome back again to MBC's Veterinary Technician Review course. We're going to continue on with 1.1 Introduction to the Profession and talk specifically about public and environmental health. So veterinary technician safety is important, and we're at risk due to personal injury and hazards. So personal injury, we do a lot of heavy lifting. We deal with a lot of aggressive animals or a lot of afraid animals even that become aggressive just to protect themselves. So we're definitely at risk, and veterinary technicians may be the most hands-on with these patients within the clinic. So different types of hazards that can affect us within the clinic would be infectious diseases that these patients may have, harmful chemicals that we use on a daily basis, radiation, and animal-induced hazards as well. We have to be familiar with OHS, okay, occupational health and safety, and our responsibilities. So we need to learn and follow the safety rules. We need to read the OSHA posters and information, comply with applicable standards. We need to wear or use the PPEs, the personal protective equipments, to maintain our safety, and report hazardous conditions, report job-related injuries or illnesses, and seek treatment promptly. So as far as our attire goes, we have to dress appropriately for the job at hand. Most of us wear scrubs on a daily basis, but may require to put on a lab coat, isolation clothes if we're dealing with a patient in isolation, and minimal jewelry. They can get caught and snagged on a lot of things, very dangerous, and cover the entire foot with non-slip shoes. I don't know how many times I've been in a clinic with slippery shoes, and the floors are often wet, either from being mopped or being peed on. So you can't have slippery shoes, very dangerous. Lifting animals. So a lot of people, technicians are typically required to be able to lift up to 50 pounds. And it's very important that when we do lift that 50 pounds that we do it properly. So back injuries account for 1 in every 5 workplace injuries, and that's why we have to be careful. Basically, the rule of thumb is to, when you're lifting, back straight and lift with your legs. Anybody that's worked with me in the past has always heard me say, lift with your legs, because most people tend to want to bend at the waist, and you can hurt your back and lift with your back. It's very dangerous. So very important to bend with your knees. Cleanliness in the workplace. I don't know about you guys, but whenever I'm in a workplace that has messy counters or the treatment tables full of supplies and garbage and stuff like that, it makes me feel like it's chaotic. Even though it may not be, it stresses me out. So clutter or dirty work areas can cause injury. So not only can it cause a stressful, disorganized workplace, but it can also cause injury. So cleanliness and organization, good business standards, especially in the healthcare facilities. You can't have all this stuff laying around. It's a very busy profession. We're running around a lot, and we're just putting ourselves at risk if we have things laying around. So how can we make sure that we're doing things right? Clean spills immediately, return used equipment after you use it. Don't have that laying around. Organize your drawers. Not only is this for cleanliness and safety, but also during an emergency situation, you need to be able to go somewhere and know that whatever it is you're looking for is there for you. And clean counters. I always have a clean treatment counter, and as long as that treatment counter is clean, I feel like things are under control. Break time. Okay, this seems kind of silly to talk about, but we have to be aware of ingesting pathogens or chemicals. It's unbelievable how many chemicals and pathogens are present around a veterinary clinic. So when a veterinary technician or any veterinary staff really goes on break and they want to sit in the lab area and go ahead and eat their sandwich right after someone has just done a fecal analysis that happens to have a pathogen. So we have to be really aware of that and be very careful. So it's important that any kind of coffee pots and utensils are away from possible infectious areas. We don't want to transfer those pathogens around. Always store food, drinks, condiments, anything that you're going to be eating away from vaccines, drugs, and lab samples. It seems kind of silly to think that we would put stuff like that in a fridge where there's medical waste and stuff like that, but it happens. Again, veterinary technicians get pretty comfortable in their environment, and having their lunch put in the freezer with a bag of medical waste doesn't seem that crazy to a vet tech that's been in the industry for a while. So we just have to try to avoid doing this. So fire and evacuation. Fire at an animal care facility is a very dramatic loss of life. We have to be very careful. We have to know where the exits are. We have to know where the fire extinguishers are to prevent the fire from spreading. But again, don't ever put yourself at risk, and it's important to get out as quick as possible. Recently in my town, there was a vet clinic that burnt down, and unfortunately there was quite a few animals that had lost their life. So it's very sad, and we have to be very careful. So we take care by storing flammable liquids properly, store flammable material like papers and cardboards and stuff like that at least 3 feet away from an ignition source. And like I said, be familiar with the exits and fire extinguisher locations. And your first responsibility during a fire is to notify others. Most places will have one of those fire pull down things that will set off an alarm, and that's a good way to notify others to get out. Also, a lot of clinics will have a rule of thumb where they say grab an animal and go, and that's a way to prevent animal loss, but again, don't put yourself at risk. Hazardous chemicals. So it's kind of ironic, we work in a hospital where patients come to get better and get healthy, yet in these hospitals we are surrounded by hazardous chemicals and wastes. It's unbelievable how dangerous a lot of these things are. So things that we use every day are hazardous. So, for example, cleaning and disinfecting agents, we're constantly cleaning and disinfecting everything because we don't want to spread disease, right? So we're constantly spraying down tables, mopping floors. We're always using disinfectant and cleaning agents that can be hazardous. Insecticides and pesticides are commonly used on our patients, very hazardous. Drugs and medication and sterilization agents, like for our surgical equipment, all very, very dangerous, and we have to take care with that. You must be informed of all chemicals that you may be exposed to and be aware of their hazards and PPEs and all that good stuff. Safety equipment must be provided to you, and at no cost as well. It's by law. Your employer has to supply you with the proper PPE to protect you from these hazardous materials. So all harmful chemicals must have a warning label on it and an MSDS reference as well. So MSDS will provide you with precautions, instructions, and advice on handling. And also these MSDS sheets will also aid you if something was ingested or if it got into your eyes, what safety precautions or what kind of methods you have to take to help prevent further injury. So continuing on with hazardous chemicals, let's talk about what happens if we have a chemical that spills. So the first thing that you have to do is keep other people and pets away from this spill. We have to increase ventilation, so we have to open windows, open doors. We have to make sure that we're not containing these fumes in one small area. Put on gloves and any other PPE that the WHMIS sheets are going to tell you what to put on and what's appropriate. We need to cover the spill with absorbent material, either paper towel. Kitty litter is very absorbent, so we can throw that onto it as well to absorb it up. Sweep up the saturated absorbent and place it in the trash. We need to then seal this bag and dispose of it immediately so that we're not exposing anybody else to it. Wash the contaminated area with water and detergent soap. We have to not use a disinfectant because, again, mixing chemicals can be very dangerous. So we have to see the MSDS sheet and refer to what kind of soap is safe to use to clean this. And then remove your PPE. Dispose of it if possible. Some PPEs are disposable, like masks or caps, gowns, like those gowns that you can put on, especially when dealing with isolation patients. A lot of those are disposable, so you can throw those away. And clean your hands very well. And that is how you prevent very dangerous things from happening when you have a chemical spill. Zoonotic diseases. This is extremely important in veterinary medicine, and it's something that you have to worry about every day when dealing with pathogens. So it's an infectious disease that can be transmitted from animals to humans. So that's why it's important. Not only will it affect the animal, but it can be transferred to humans as well. So common pathogens that have zoonotic potentials, and we're going to go through all these and talk about them. But rabies, there's various other viruses as well that can be zoonotic. Different bacteria like Lyme disease and leptospirosis, salmonella, E. coli, cat scratch fever, which is specifically the bacteria Bartonella, and those are all zoonotic, and we have to be careful with that. Fungi, for example, ringworm. Keep in mind, ringworm is not a worm, even though the name leads you to believe that. It is literally just a fungus, but zoonotic nonetheless. Intestinal parasites like roundworm and hookworm that can affect humans. Protozoans like toxoplasma, we have to be careful with that one with pregnant women. Giardia, coccidia, and as well as external parasites like sarcoptic mange, which has zoonotic potential. So let's talk about rabies, the first zoonotic disease that we're going to talk about. Okay, so almost always fatal. There is no cure for rabies. Rabies is spread by saliva. And what happens when it is spread, it causes inflammation of the brain. So a lot of the time when someone is infected with rabies disease, it's mostly neurologic symptoms that you'll see. It's primarily found in raccoons, bats, and skunks. So anyone dealing with wildlife or have wildlife in their yard, it's very important that you're aware of this zoonotic disease. Vaccines are available and for animals and humans. So I know at the beginning of our veterinary technician course, it is highly recommended that our students get vaccinated with rabies, with the rabies vaccine, because we do handle wildlife, and as a veterinary technician, you're more at risk than anybody because you're dealing with these sick animals. So leptospirosis is another zoonotic disease. It actually causes damage to the liver and the kidneys. So it's transmitted through exposure to contaminated water, food, soil, bedding, bites, infected urine, and even transplacental. So a lot of the time, especially in the Halifax area where we are, leptospirosis was being spread through contaminated waters, and that's how our animals were getting it. And again, if a mother has leptospirosis, it can be transferred transplacental as well. So babies can be born with it. It's primarily found in stagnant water, which is how we were seeing it here in Halifax. And vaccines are available for patients at risk. Again, it's not a core vaccine. It's not given to every patient, the lepto vaccine, but patients that are camping a lot or hunting dogs, all these animals that are at higher risk of contracting leptospirosis should be vaccinated, absolutely. Ringworm, again, not a parasite, even though it's called ringworm. It is a fungal infection, and the specific fungus that causes ringworm is called microsporum, and it causes a round superficial cutaneous lesion. So it's very circular and it's very distinctive. Cats and horses are particularly susceptible, but still commonly seen in dogs as well. We have to be careful. It has happened so many times in my career that a patient comes in with ringworm, and then it's spread from animal to vet tech. And then all of a sudden we have a few vet techs that have ringworm, so it's very zoonotic. It's important to wear protective clothing and gloves when handling an animal that has ringworm, even if this patient's coming in and it has these circular lesions and we're not sure if it is ringworm, it hasn't been diagnosed yet. Just be careful with these lesions, because if it is ringworm, it's very, very possible that you as a vet tech can contract it just by handling the animal, because it is spread through direct contact. This is a picture here of a beautiful bulldog, and he's got 3 lesions here on his left arm, and these are very, very typical of ringworm lesions. So if we want to take a look at this picture and we can analyze it, that person right there is putting themselves at risk for getting the ringworm because they're not wearing any kind of PPE. And those clippers, take a look at those clippers. Imagine if we use that to shave those ringworm lesions, and then we just put the clippers down, and then the next patient comes in and needs an IV catheter placement. Healthy patient, absolutely healthy, nothing going on with them, but we use those exact same clippers that are now contaminated with the microsporum fungi, and now that patient can contract it as well. So we have to be really careful with equipment that we use on these guys to properly clean it and sterilize it if possible afterwards, so that we're not spreading it from patient to patient, not only patient to vet tech. Lyme disease. So Lyme disease is a zoonotic disease, and it causes painful joints, fever, and flu-like symptoms. Okay, and these are transmitted through tick bites. So that's our biggest concern with these ticks. You know, ticks, they go on and they suck your blood, but again, on a normal, healthy adult with a normal blood supply, it's not going to cause anemia or anything like that. The biggest concern with these ticks is them transferring Lyme disease. And it can be tricky in horses because they're asymptomatic, so a lot of the time they go undiagnosed. It's the deer tick specifically that transfers the bacteria, and it's called Borrelia, and that's the one that causes Lyme disease. If walked in a wooded area, make sure that you check your animals and yourself for ticks and remove it promptly. Use insect repellent on yourself to try to help repel these ticks. There's not many products that are used for tick repellent. I know there's Advantix, which is a very good product for tick repelling, but for yourself as a human, there are products out there that can help prevent this. And a vaccine is available as well for Lyme disease. This is a picture here of a tick that's connected to a human, and it's created quite the lesion around where it was attached, and it's quite irritated and inflamed, and could potentially have transferred Lyme disease at this point. So let's talk about cat scratch fever. So cat scratch fever is a zoonotic disease, and it causes flu-like symptoms. It's actually transferred from the feces of a cat, and when they're scratching in their litter and they get their feces caught in their nails, and then after that they go and scratch someone, the bacteria called Bartonella then is transferred to the human, and that's how you get cat scratch fever, and it causes flu-like symptoms. Giardia. So Giardia is a protozoan. It is not a parasite, it's a protozoan, which means it's a single-celled organism. And Giardia is often found in contaminated water. So again, with people camping or hunting or fishing, anything like doing anything like that will expose you potentially to Giardia. And Giardia causes a GI upset. So and it can be transferred from humans to animals and animals to humans. So very zoonotic. This here, the Giardia cyst is the very first stage of the life cycle. So this is the resting state. Okay, so it's non-infective. So if you take a look at this picture here, you can see a Giardia cyst. It's non-infective, but it's very resistant to non-ideal environments. So even though it could be very cold, very warm, it can still thrive. Okay, it's very small. This picture shows a Giardia cyst beside a yeast, and we all know, or hopefully we all remember and know how small yeast is. So it's very small, very hard to detect on a fecal analysis, and is shed in feces and waits for the ingestion from another host and then infects them. The next stage, and it's the last stage of the life cycle of the Giardia, is the trophozoid. So once the cyst is ingested by that host, the motile tear-shaped trophozoid emerges from that cyst, and it feeds on the gut. So this trophozoid, a lot of people refer to it as having like a ghost kind of face to it. It's actually moving and swimming. And when you look at it on a fecal analysis, it has a falling leaf appearance. So it kind of sways back and forth as if it's a falling leaf. And that is one of the quickest way of identifying a Giardia trophozoid. It's that movement that it has. It's still very small and very hard to see microscopically. I myself have a very hard time finding Giardia, and some technicians are very good at it, but it's very challenging. And I think for a lot of people, that's why it's challenging for a lot of people, and that's why they've come up with the Giardia SNAP test by IDEXX, and it can detect Giardia and tell you if they're positive or negative for it, which helps you diagnose it. Okay, on to internal parasites and their zoonotic potentials. Let's talk about roundworm. So roundworm is a nematode, okay? So it's called roundworm because they're round when observed on cross-section. So if you take a roundworm and cut them in half, they have a round appearance, okay? And Toxocara canis is the roundworm that affects dogs, Toxocara cati, which is the one that affects cats, and Toxocara leonina affects both species. And these are 3 roundworms that will cause larval migrans when ingested by a human. Okay, so if a human accidentally ingests one of these Toxocara eggs, the larva will submerge from this egg and then start migrating through that person. Okay, so the human's actually a parentenic host, which means like an accidental host. It's a host in which the parasite does not undergo further development, but it will insist and potentially cause damage. So so technically we're an accidental host for this Toxocara. So even it will turn into a larva and start migrating through our tissues, like through our liver, through our lungs, and it can cause damage to these tissues. And a lot of the time we'll see these Toxocara larval migrants make their way to the eye, and it can cause blindness. Most people that have a really good immune system aren't really affected by it. If they do ingest it, they'll just pass it and be completely asymptomatic, and it's not going to cause an issue. But if there's any kind of immunocompromisation, for example, if you're a child or or for elderly, their immune system is suppressed. Okay, or anybody with diabetes or undergoing chemotherapy, their immune system is suppressed. And so when if they do ingest one of these Toxocara eggs, the larval migrant can really do some damage while it's traveling through the body and potentially make its way to the eye, causing blindness. So there's 2 types, like I said in the last slide. There's 2 types of larval migrans. There's the visceral larval migrans, which travels through the viscera, and then the ocular larval migrant that finds its way to the eye. So a child or an immunocompromised human, like we had discussed, ingests the egg, and it's transmitted through fecal-oral route. And it may seem kind of silly to some people, like, well, who eats poop? This would never happen, right? But I know, children, let's say you have a dog and he has roundworm, and it's very possible, it's a very common intestinal parasite, and he uses the washroom outside in your backyard. But as a good owner, you're like, you know what, I pick up my poop because my kid plays back there. I pick up my dog's poop. There's no issue there. But what if there's a little bit of residual feces that's left on that grass, or an egg happened to fall off into the grass or whatever, and your child's running around playing in the grass and happens to get this egg on his hands. Later on, he goes in and he sits down for lunch and starts licking his fingers after his peanut butter sandwich. And there you go. He just ingested a roundworm egg. And that's not so far-fetched. It's very possible. I have a child myself, and I can't tell you how many times he's mauled my dog and all over him, and potentially grazes his hind end, which may have a roundworm egg. And then he may, again, lick his fingers and then ingest it that way. So even though it sounds kind of crazy and silly, it is very, very possible for this to happen. What if a dog, for example, is cleaning himself and licks his hind end, and then later on goes and finds grandma and gives her a big wet kiss on the mouth, and then grandma has ingested now that roundworm egg. So it's not that far-fetched. So what will happen? The larva will hatch from an egg, and then it'll migrate. So the visceral larval migrate travels through different organs, causing major damage, and the ocular one will find its way to the eye, causing blindness. So it's important to stay away from sandboxes or any area where dog and cats feces can be found. So around the garden, in sandboxes, a lot of outdoor cats will use those as a litter box, right? So we have to keep our children away from that. And so important to try to help out with the prevention of this zoonotic disease by deworming your pets. I think every outdoor cat and dog should be dewormed on a monthly basis to prevent the spread of this. And it's very important to wash kids' hands all the time, especially after playing outside. Very important. So, again, the ingestion of these eggs with immunocompromised patients may seem a little bit far-fetched for some people, but in 1998, a study was actually done by the WK Children's Hospital. That's the hospital that's here in Halifax, Nova Scotia, and 173 children were tested by the ages of 7 and 15, okay, here in Nova Scotia. 25.6% of children in rural areas and 14.6 in urban areas were carrying the antibody for Toxocara canis. Okay, so that means a quarter of these children were exposed to Toxocara, to roundworm. Now, hopefully, in most of these cases, they were completely, they just passed it and their immune system fought it off just fine. But it would be interesting to know how many of this 25.6% of children were symptomatic or even became blind because of Toxocara ingestion. So veterinary pathologists believe there is no reason to expect that this situation has changed. Therefore, the point of this is that a quarter of our children are being exposed to Toxocara. That's how common and likely it is. Hookworm, another intestinal parasite, okay? And it is zoonotic. So hookworm is another nematode. Okay, so these nematodes all have a round look to them. Hookworms being much smaller than your Toxocara roundworm. So ancylostoma is an uncinnaria. Okay, there's 3 different kinds of ancylostomas and 1 uncinnaria, and you'll have to excuse my pronunciation if I'm not pronouncing them right. And but that's how I say it, tomato, tomato, right? So there's 4 different types of hookworm that can cause cutaneous larval migrans. So these larvae will migrate cutaneously. So cutaneous just means through skin, right? So the larva will penetrate the skin and travel within its superficial layers of the epidermis, okay? So this causes extreme pruritus and twisting tracts in the skin. Very, very itchy. So that's how it is zoonotic, not by ingestion, but by cutaneous. So if you're walking down a beach and there happens to be a hookworm egg or on the grass, these larvae can hatch and find their way through your skin. This here is a picture of someone that was infected with hookworm. So this guy could very well have just gone down to Cuba, was walking down the beach, and all of a sudden he gets infected with hookworm. And these are larvae that have made their way cutaneously and very itchy and very sore. So let's talk about medical waste, okay? So medical waste poses a risk to the public and the environment. So not only do you have to protect yourself, but you have to protect everybody in your community as well. So treatment, storage, and disposal of hazardous waste is regulated by the government. And these medical waste cannot be disposed of by common means. We can't just put it in the regular garbage. It's very important that we know the proper disposal techniques. So let's talk about sharps, okay? So when we say sharps, it means any device that can puncture, lacerate, or penetrate the skin. Now, these sharps go into special medical waste. Any needle, scalpel blade, glass, or plastic that is contaminated with human diseases goes in a special medical waste container. It does not, what does go in normal trash is glass or hard plastic that is not contaminated with a human disease causing agent, okay? So anything else that can cause disease to humans has to go in a special sharps container or a special medical waste. Medical devices, for example, blood tubes, vials, catheters, IV tubing, these go in special medical waste only when they contain a human pathogen, or if they were used for chemotherapy, which can negatively affect a human as well if they come in contact with it. So any human pathogen or chemotherapy drugs need to go in a special medical waste to prevent harm to the public. What goes into a normal trash is any of these materials if they've only been contaminated with animal blood, non-infectious animal blood specifically. So animal blood and tissue. Okay, so goes into special medical waste. Dead animals or parts that are infected with a zoonotic disease has to go into a special medical waste. Now, that being said, it's not like we put a euthanized dog in, although a euthanized dog does contain the euthanol chemical, the phenobarbital chemical, and or sorry, pentobarbital, not phenobarbital, pentobarbital chemical, which is harmful to the environment. Therefore, we do have to have it cared for by a special company. But what goes into normal trash is tissue from routine surgical procedures that are considered regular waste. So again, we're not going to be throwing whole limbs or anything like that, or bodies into the trash. There are special ways to deal with that. But any kind of small bits of tissue or blood that's non-infectious to humans can go into the regular trash. Lab cultures. Okay, so microbiological cultures like viral, fungal, or bacteria of human pathogens have to be disposed of in a special way, because if we throw that into the regular garbage and another person comes in contact with it, it may very well transfer that pathogen to that person and infect them. So we have to be careful. You know, with these culture plates, we're growing pathogens, and we have to be careful if it's infective to humans to not just throw it into the regular trash. It does go into the normal trash if obviously if nothing has grown, there's nothing there, there's no culture, but safer to dispose of it as if it were biochemical waste anyways, just to be sure. Bandages and sponges. So it goes into a special medical waste. Use bandages, materials that contain blood or body fluids, again with human pathogens. If it can be a pathogen that can infect a human, we have to dispose of it in a proper medical waste. It can go into the normal trash if it's not infected with a zoonotic disease. Animal waste, okay, like feces, urine, vomitus. Waste from animals infected with zoonotic diseases in chemotherapy patients. Those chemotherapy patients, it's only up to 48 hours that it can be transmitted through their feces, urine, or vomitus. And so those have to go into a special medical waste if it has a zoonotic disease, or if it's a chemotherapy patient that received treatment within 48 hours. Those need to go in a special medical waste because it is hazardous, but it can go into the normal trash if it's just typical waste that is not infected with a pathogen that can be transferred to humans.